Have you been diagnosed with insulin resistance or type 2 diabetes? Many people don't even realize they have diabetes until their skin starts showing warning signs. Treating skin infections early is crucial because if ignored, they can get worse and become extremely difficult to manage. Hi everyone, and welcome to Mystic Health. Today, we're discussing 12 physical signs you should never ignore. It's crucial to understand that in India alone, over 100 million people live with diabetes, and shockingly, half of them don't even know it. That could be you, your family, or a friend. Diabetes, caused by high blood sugar, impacts the skin in numerous ways, affecting circulation, immunity, and hydration. So, unexplained skin changes can be an early warning sign. But don't worry. In this video, I'll walk you through 12 diabetes-related skin conditions, helping you spot them early and offering self-care tips and tricks. These tips will be shared throughout the video, so watch until the end. It could be life-changing for you and your loved ones. Let's get started. If you notice any of these signs, it's vital to see your diabetes doctor and dermatologist regularly. First up, skin patches that are yellow, red, or brown. Medically, this is called necrobiosis lipoidica. These start as small, raised, hard bumps, almost like pimples, a common symptom of this condition. Over time, these pimples can develop into swollen, hard patches of skin. You might also see yellow, red, or brown spots appear. Necrobiosis lipoidica often appears on the legs, characterized by those red, swollen, and hard patches. You might also notice the surrounding skin taking on a shiny, almost porcelain-like finish, and you might even see blood vessels beneath the surface. The skin can become itchy and inflamed. This condition can have periods of activity and inactivity, sometimes even recurring. So, remember, necrobiosis lipoidica is the medical term. If you haven't been diagnosed with diabetes, or if your diabetes isn't well controlled, please take action now. Get tested, and if you have diabetes, work closely with your doctor to manage it effectively. While necrobiosis lipoidica itself isn't inherently dangerous, it can cause complications and shouldn't be ignored. Number 2, velvety, dark patches of skin. These can indicate too much insulin in your body. If you have a dark or brown velvety patch, it might be on the back of your neck, in your armpits, your groin, or elsewhere. This is also very common in prediabetes. We're talking about Acanthosis nigricans, that's the medical name for this skin disorder. Acanthosis nigricans causes the skin to darken, especially in the folds of your skin, like on your neck. This can be one of the very first signs of diabetes or insulin resistance. Number 3, skin that is hardening and thickening. The medical term for this is digital sclerosis. It affects the fingers, toes, or both. The back of your hands will have tight, waxy skin. Your fingers can actually stiffen, making movement difficult. If your diabetes has been poorly managed for years, it can even feel like you have pebbles in your fingertips. The skin becomes hard, thick, and swollen-looking. It can spread to your forearms and upper arms, and sometimes even appear on the upper back, shoulders, and neck. Occasionally, this thickening can extend to the face, shoulders, and chest. Skin around the knees, ankles, and elbows can also thicken in rare cases, making it difficult to straighten your leg, point your foot, or bend your arm. The thickened skin often has the texture of an orange peel. People with poorly controlled diabetes are more likely to develop this condition. So, if you have this, be sure to tell your diabetes doctor. Better diabetes control can definitely help. Alpha-lipoic acid, benfotiamine, and similar supplements can be helpful, too. Physical therapy might be needed if you have physical limitations, helping you maintain your ability to bend and straighten your joints, especially when the thickened skin develops on your fingers, toes, or other joints. Number 4, blisters. While not common, people with diabetes can develop blisters on their skin. These can be large blisters, a group of blisters, or both. They typically appear on the hands, feet, legs, or forearms, and resemble blisters after a severe burn. However, unlike burn blisters, these are usually not painful. They just look like balloons on your skin. The medical term for this is bullosis diabeticorum, or sometimes just diabetic bully. These blisters should be reported to your doctor, as you'll need to take precautions to avoid infection. Consult your primary care doctor, podiatrist, dermatologist, or diabetes coach for advice on managing your diabetes and these blisters effectively. Number 5. Skin infections. If you experience frequent yeast infections, impetigo, or are prone to infections in general, you might have diabetes or uncontrolled diabetes. With a skin infection, you'll notice one or more of these: hot skin, swelling, and discomfort. You might also see an itchy rash with small blisters. Your skin can be dry and scaly, and discharge is common. It could be pus or a cottage cheese-like discharge. These infections can occur anywhere, but are more common between the toes, around the nails, or even on the scalp. Keeping your toes and toenails dry is extremely important to prevent fungal infections. Treating skin infections promptly is crucial, otherwise, they can progress and become very difficult to treat, especially with diabetes and uncontrolled high blood sugar. If you have diabetes, you might need more aggressive treatments, stronger antibiotics, or a longer course of antibiotics. Number 6. Open wounds and sores. This is a bit more serious than just an infection. It may or may not be infected, but if you have poor circulation or nerve damage, often from uncontrolled diabetes, you can develop these wounds or deep ulcers. Your body's ability to heal even simple cuts can be hampered by poor circulation and nerve damage. As a result, a small lesion can become complicated, getting deeper and turning into an ulcer, an open lesion prone to infection. If you have diabetes, inspect your feet daily for sores and open wounds. Don't rely solely on your doctor or nurse checking your feet every few months, because a lesion can worsen within days. Check them yourself every day, it's far more effective. If you have an open sore or wound, seek medical attention immediately. Untreated lesions can lead to serious infections and sometimes even amputation. Work closely with your doctor if you see anything like this. Number 7. Shin spots. This skin condition causes spots, and sometimes lines, that create a barely visible depression in the skin. While not exclusive to diabetics, people with diabetes are more likely to experience it. It's called diabetic dermopathy. It typically develops on the shins, but in rare cases, can appear on the arms, thighs, trunk, or other areas. These brown spots are common and usually have no symptoms. Many people mistake them for age spots. Because they're often asymptomatic, these spots or lines, unlike age spots, usually disappear within 18 to 24 months. However, diabetic dermopathy can sometimes be permanent if your diabetes is not well controlled. Number 8. Small, reddish-yellow lumps. This is called eruptive xanthomatosis. These lumps often resemble pimples initially, but they quickly turn a yellowish tint. They're usually found on the buttocks, thighs, elbows, and behind the knees, but can appear anywhere. They're often tender and itchy. Eruptive xanthomatosis is the medical term, and these bumps typically disappear quickly when your diabetes is well controlled. Number 9. Raised lumps that are red or skin-colored. These are called granuloma annulari. The connection to diabetes is debated. Most people with granuloma annulari don't have diabetes, but studies suggest it's more common in people with diabetes. So, while the overall incidence might be low, it's higher in diabetics. If you have granuloma annulari that comes and goes, you should be evaluated for diabetes. This skin disorder causes bumps and patches that can be skin-colored, red, pink, bluish, or purple. If you get pimple-like bumps, especially like the one shown here, tell your doctor, especially if they're recurring. Number 10. Dry, itchy skin. Extremely dry, itchy skin is very common in people with diabetes. This can be caused by high blood sugar, skin infections, or poor circulation. Number 11. Scaly, yellowish spots around your eyes. This is called xanthelasma. These appear when there are too many fat cells in your blood, indicating poorly managed diabetes. Number 12. Skin tags. Many people have skin tags, small growths of skin. While generally harmless, having a lot of them can indicate too much insulin in your blood or even type 2 diabetes. The eyes, neck, armpits, and groin are the most common locations for these growths. Now, for those tips I promised at the beginning. Let's talk about caring for blisters. First, do not attempt to pop or break the blister. The skin covering it protects it from infection. Gently wash the area with warm water and mild soap. Apply antibacterial ointment without popping the blister, and cover it loosely with gauze and cotton bandage. Use hypoallergenic or paper tape to secure the bandage. Change the bandage at least once a day. If the blister is on your foot, wear different shoes until it heals, especially if the blister was caused by your shoes. Next, small cuts and rashes. Gently wash the area with warm water and mild soap. Do not use alcohol, it can actually hurt. Apply antibiotic ointment and cover with a gauze pad or cotton bandage. Secure it with hypoallergenic paper tape. Change the bandage daily. Check the area frequently to make sure the discomfort isn't worsening and an infection isn't developing. Now that you know these 12 important skin warning signs, don't ignore them. Your skin could be giving you an early signal about diabetes, and catching it in time can make all the difference. If you've noticed any of these signs, don't panic. The best step is to get your blood sugar checked and consult a doctor. Want to know how to naturally control and even reverse diabetes? I've written an ebook, 2 Steps to Become Diabetes-Free, where I share simple but powerful steps to take control of your health. Click the link in the description to grab your copy now. If you found this video helpful, like, share, and subscribe for more health tips. Stay informed, stay healthy.